Okay, welcome back. I'm Kim Lockhart, and I am a teacher in Kingston, Ontario, and I am super excited for this Speaking with Stacey episode. This is our second time getting together with Stacey, who is a speech and language pathologist in the southwestern school district. Stacey is a certified teacher registered through the Ontario College of Teachers and the College of Audiologists and Speech and Language Pathologists. So thrilled to have Stacey here to answer our most burning questions as classroom teachers and to help us support our students who struggle with speech and language. So thanks for coming back, Stacey.
Glad to be here.
All right, so our topic today is all about helping our teachers as well as our students in terms of how to best screen them and looking at language comprehension through the MTSS model, or the multi-tiered systems of support. Frequently, classroom teachers hear about the MTSS model through the topic of word recognition and screening students with word recognition difficulties, but I strongly feel like we need to start looking at our students who struggle with language comprehension also through the MTSS model, providing stronger tier 1 support, reducing the burden, reducing the number of referrals on tier 2 and tier 3. So my first question for you is, what is the MTSS model and what does it look like through the lens of a speech and language pathologist?
Absolutely. So, yes, speech language pathologists in the schools across Ontario are embracing the MTSS framework, I guess I would call it. It's a framework for tiered supports for students who have any sort of learning difficulties and or behavioral difficulties. So these are tiered supports where the school team would look at what's being done in tier 1 to support a child who may or may not have some risk. Then through some screening and careful watching of classroom performance, knowing who might need some tier 2, more intensive kind of small group targeted kind of support. And then at tier 3, we might have some children, we would expect maybe 1 to 5% of the kids to require some more intensive one-on-one support, possibly a small group or small short-term intervention with a speech language pathologist. So those would be kids who are really found to be at very significant risk for not developing proficient oral language skills to be able to access curriculum and participate alongside their peers. And that's really what speech language pathology in the schools is about. 2 main areas of focus. 1, increasing access to curriculum, and 2, participating alongside peers, meeting their potential to the best of their ability.
Fantastic. So essentially what you're saying is we need to apply the MTSS model for students who struggle with language comprehension in a similar way that we're applying the MTSS model for students with decoding and word recognition difficulties by strengthening our classroom instruction to reduce the need on that tier 2 and tier 3, and essentially making sure that we are leaving that tier 2 and tier 3 support for the students who actually have severe difficulties, and not just for the students who are not getting the instruction they need in the regular classroom. Is that correct?
Absolutely. That is why universal screening is important to determine who is at risk, but who also is responding well to good evidence-based, research-informed, carefully planned, thoughtful classroom teaching.
Fantastic. So my next question has to do with what screening tools may be available for students and teachers who want to screen students for risk of language comprehension. So currently across Ontario, the Ministry of Education has recommended several screeners for word decoding difficulties. In our school district, in my school district, we are using Acadians, and Acadians screeners are currently being used to identify students who are most at risk of word recognition and word reading difficulties. What screening tools are available for teachers to screen for risk of language comprehension difficulties?
Yeah, a really good question. And we're hearing more and more of that as people come to an understanding of, as you've mentioned, those tools that the ministry has given a stamp of approval for school boards to be using for universal screening of word reading skills. But yeah, what is going on with the other side of the reading rope, the language comprehension side, and how do we screen for that? So there's some work to be done in this area for sure. But there are a few tools out there that I can speak to. And when I'm thinking about this, I always think about the work of Tiffany Hogan and her colleagues. And recently in May of 2024, Tiffany Hogan came out with a very nice article in the American Journal of Speech Language Pathology. And in this article, she describes how her team evaluated commercially available oral language screening tools. The point of those tools really is to determine risk, just as it is on the other side for when we're screening decoding, who is at risk for having difficulty meeting the oral language standards for their age and grade. So the three screeners that kind of got the best billing from her article, and she looked at things in terms of accessibility. So how accessible are these screening tools for educators in schools? She looked at usability. So how are they used? How easily can they be administered by educators? What kind of training do people have to be able to use it? That kind of thing. And then the third thing she considered was psychometric properties. So in the world of speech pathology, we would call this sensitivity and specificity. And what I mean by that is really just like making sure we're not getting false positives or false negatives, that kind of thing. So there were three tools that kind of floated to the top. And one is the SELF-5 screening test. So the clinical evaluation of language fundamentals, the 5th edition. That's a mouthful. So there's a screening test there. The Student Language Scale Screener, also called the SLS, that's my particular favorite. And it also has the best sensitivity and specificity out there. I use it in my own practice, and I find that educators and parents alike really like it. And it does collect information from educators and parents, which, the more data we have, the better. And then the third one that got quite high billing in this research report was the PLS-5, which is the Preschool Language Scale 5th edition. And there's a screening version of that one that scored well in terms of accessibility, usability, and psychometric properties. So there are others out there. There are things like the Cubed that are free. And, I would really just encourage classroom educators, school board admin to have a good chat with their speech language pathologist. She probably has access to many of these tools and can show you those things and explain sensitivity and specificity, or do a little demo to say, this is what a teacher would have to go through to be able to complete this, so that schools could land on things that suit them best.
That's fantastic. I was actually writing those down as you were mentioning them because this is all news to me as well. So as a classroom teacher, but I'm also the student support teacher in my school district, If I were to do the screener on a group of students or on all the students, and I have some students who um, have been identified as being at risk of language difficulties, would I then make a referral to my SLP, or what interventions can I use in the classroom before I make that referral to the speech and language pathologist?
Really good question. You could do both of those things. So you don't need to wait for a speech language pathologist to do an assessment to give you some recommendations around things such as, building a child's vocabulary or improving their reciprocal conversation skills. If you have noticed that there's a difficulty in that area, that a child isn't performing like his or her peers, or that your screener is throwing up a flag and saying, hey, there's an area of concern here, this child is at risk, you certainly can dig in to really increasing the frequency, the intensity of the good programming that's already going on. So, for example, if you're doing robust vocabulary instruction using nice vocabulary routines in the classroom, and you are realizing that you've got a few kids in the classroom for whom that vocabulary is not sticking and not being used as easily, you might group those kids together for a little reinforcement of that particular group of vocabulary words that are hopefully related to each other in some way, because some careful planning was done in the selection of the vocabulary and topics that were going to be taught. So.
Fantastic. Now, my next question, which also has to do with this screening and identifying students at risk, having screened my students using an Acadience screening tool, I can identify students who are at risk of reading difficulties. Sometimes what I find is that student doesn't actually have reading difficulties. They have just a lack of instruction. Sometimes I hear the word dystechia, not dyslexia. So the student with dystechia, who just hasn't been taught yet, looks very similar to the student with dyslexia, who has an actual I don't want to say disability, but who has an actual identification of a learning disability. And so often when I'm looking at my students, and again, I'm doing this as if I'm holding the simple view of reading in my hands. That's what I'm doing. So I'm holding it over here because that's the decoding piece. And now I'm going over to the language comprehension piece. When I'm looking at my students who struggle with language comprehension, how am I going to know if they actually have a language comprehension disability or learning disability in learning how to comprehend language versus they just haven't been taught? Because sometimes those profiles look very similar.
Right. So this is where you would look at your response to intervention, an important part of the MTSS model, right? So as with the decoding end of things, if you find that by providing a structured literacy intervention or support results in a child's reading skills improving. Similarly, on the other side, if you find that a systematic, explicit, intentional, well-planned teaching of oral language skills results in improved oral language performance for the student, you would know that you're on the right track. For students who do not progress well with that, that's where you would want to engage your speech language pathologist for sure to say, okay, we've got robust tier 1 happening. We're including him in our tier 2, where we are providing him with more opportunities to respond, more opportunities to hear. Maybe it's language structures or vocabulary or whatever the target is for the small group. And the rest of the group is responding well. This child is not. Can you help with some more formal, like tier 3 assessment and intervention, perhaps? Most likely, I would say, right? Those kids who kind of float through to the top when the tiers have been appropriately applied, and we see that that child needs something very specifically targeted to his or her profile.
Perfect. And on that topic, I actually have a resource here that I often go to. It's called RTI in Action, Oral Language Activities for K to 2 Classrooms. And the purpose of this teacher manual is to help me reduce the number of students who are referred for tier 2 and for language assessments, because I want to make sure that the instruction they're getting is strong enough to reduce the number of kids who are referred. And then the referrals are actually for students who have more severe need than those who just haven't had the instruction. So this is
Absolutely.
a great resource, and it comes from the American Speech Hearing Association.
Love.
So my next question for you is, how can I get my school and school district to learn more about the multi-tiers of support for language and not just for word reading?
Absolutely. Well, an important thing is just to continue to spread the word. So to, engage in those good discussions that are already going on around word decoding and spelling, and piggyback and say, that's wonderful. Now, what about the other side of that reading rope? What are we going to be doing there? Yeah, really sort of building momentum. We started somewhere with the decoding side of things, and look where we've gone with that. So the next thing is to really look at the oral language strands, vocabulary, grammar, syntax, background knowledge, all of those wonderful things that are crucial for accessing curriculum and participating alongside peers. So just keeping the conversation going, I think, is really important. Also, going back to our discussion of universal screening, requesting materials and training in universal screening for oral language skills for children to determine who's at risk there.
Perfect. Thank you. I certainly am trying to do that in my school district.
Mhm.
And my last question is, well, I have two questions left actually. How do I know if a student's speech sound errors are age appropriate, or if I should actually make a referral to the child for an assessment? And I know some of these questions sound redundant, but I am trying to really tease out the articulation from language component.
Sure. So that is the easiest question of the day. There is something out there, you'll want to write this down, and it is called the Speech Treehouse. So it is a beautiful infographic that was developed based on McLeod and Crow's research in the past few years, where McLeod and Crow used aggregate data around the typical age of acquisition for English consonants for children. And a beautiful infographic that's very friendly for educators, parents, and speech pathologists to refer to. And it basically shows you, here's the sound, here's the age that we would expect 80 to 90% of kids to have that sound. And so if you look and you say that child is older than this and still doesn't have that sound, that's most likely a very good referral for your speech language pathologist.
Perfect.
Now,
Thank you. I love those concrete resource suggestions.
excellent. That said, every once in a while, a child has a speech difficulty that isn't something that might be captured well on that treehouse chart. So for example, if a child has what we call a lateral lisp, okay, so a lot of the sounds are coming out the side like that, and they sound very slushy. So that slushy speech, which is all out the sides, at no age or stage is that something that we expect. That is not a developmental stage that children work through. That is something atypical that should be addressed by a speech language pathologist early on. So in cases like that, where a teacher says, ooh, this is a little, there's a little bit more going on than just looking at the sound and knowing that my child is saying tutti instead of cookie, for example. Those are the kinds of examples where it would be totally appropriate just to talk to your speech language pathologist and to say, this is what I hear. I don't really know how to describe it. I don't think that your treehouse chart is really capturing what I'm hearing. And we're a friendly bunch. We are almost always willing to walk down the hallway and lend an ear and go, oh yeah, just send that one my way. So yeah.
Well, and it's true for the SLPs and CDAs here in Kingston as well.
Yeah.
And now my final question is, what is alternative and augmentative communication, AAC, and why does the speech and language pathologist seem to recommend it for all of my non-speaking students?
Good question. So AAC, yes, augmentative, meaning that a child already has some method of communication that needs to be augmented to increase the functions of communication that the child is able to express. So that the child isn't just restricted to requesting, for example. We want kids to be able to comment and to joke and to jump in and respond. So that's the augmentative piece. And then alternative communication is when a child is non-speaking and doesn't have any other kind of system such as sign language or something to communicate. And so a device, usually a speech generating device or a speech output or voice output device is provided, and the child is taught either symbol recognition for symbol communication, or for our kids who can decode, we might have a text-based voice output system where they can use text, typewritten words. They might be typing, or there could be some phrases that they can select quite easily and put out. And as to your question about why speech language pathologists recommend AAC for students who are minimally verbal or nonverbal, there's a lot of research out there that tells us that when we introduce AAC tools to students who are minimally verbal or nonverbal, their verbal capabilities are actually grown through their learning of symbol communication and use of a voice output device. So a lot of the time I will get questions from educators and parents to say, well, we just want him to talk. So we don't want to give him a talker, which is often what we call our voice output devices. We don't want to give him a talker that talks for him because we hope that he's going to learn how to talk. And I say, oh, I'm so glad you said that, because here's a whole stack of research that shows us that when we introduce voice output systems to children, it helps them to build vocabulary. It helps them to learn how to put words together to make utterances that can then turn into sentences. So the voice output device is really a scaffolding tool for meeting future potential in students who may develop verbal abilities, and many of them will not. And that's okay, because we start early enough in introducing AAC and they can become very proficient with the use of those tools.
Fantastic. We have a couple of students at my school who are using some of these devices to help them communicate. And I'm thrilled that Kids Inclusive as well as some people through Hotel du the Hospital have provided us with these communication devices en français. So we have our non-verbal students who are in French immersion able to grow their own oral language skills in French because they are, of course, in the French immersion program. So yay.
Yeah,
Yay
a
for that.
lot of these tools can be programmed for multi-language use. Yeah, French, Spanish, English. Some of my kids even have Danish capability if they were to need it.
Nice.
So
That's
yeah,
amazing.
it's totally amazing. And well, symbol communication, it's such a great thing, right? Because if you think about it, if you were to get on an airplane and go to, well, Norway tomorrow, you would arrive there and would have a super hard time reading signs and things like that. But you
Yes.
know that in international travel, when there's a symbol for the washroom or a symbol for be careful crossing the road, or symbol for here's where the metro or the subway is, those are universally understood, which is why symbol communication is often recommended for students who don't have well-developed verbal abilities.
Fantastic. Thank you very
Universal
much.
design, right? Universal
Universal
design.
design,
Yeah,
UDL.
you got it.
Well, thank you so, so much. That is 20 minutes of speaking with Stacey. And honestly, I learn something new from you every single time I hear you speak. So I know that we need to embrace our speech and language pathologists more. We need to learn from our speech and language pathologists because you have such a wealth of information that will help me be a better classroom teacher. So thank you for sharing with me and for other teachers and with
No
other
worries.
teachers.
Yeah, these are the conversations that people would like to have with me in the hallways. But there's always somebody having some sort of an emergency or something, it seems. So I love these pretend hallway chats with you.
Well, we're definitely on
Where
the same wavelength. And in terms of what we chose to wear for this, I think we're on the same wavelength as well. Thank you.
absolutely, for sure. Thank you.